Hi, I'm Dr. Brandon Erickson. I'm one of the shoulder and elbow and sports medicine physicians at the Rothman Orthopaedic Institute. And today I'm going to talk about some tips and tricks for throwing athletes to stay healthy and stay in shape during quarantine. One of the biggest issues we've had during the quarantine is that people aren't able to practice. They're out of their regular gym routines. They're out of their regular throwing routines. And the concern is that once everybody is able to go back to playing, that people aren't going to be in as good of shape as they would have been in had we not had this delay or time off. And so there's a couple of things that you as an overhead or throwing athlete can do at home to make sure that your shoulder, your elbow, your hips, everything is ready to go once the season starts back up, whenever that may be. The first thing I tell you about is your range of motion. So we know that hip range of motion, shoulder range of motion, and in a sense, elbow range of motion to a lesser extent, as well as trunk rotation, are all things that are very important in our throwing athletes. As you start to lose range of motion, specifically at the hip or the shoulder, you start to put stress on other parts of your body when you're throwing that really you're trying not to do. So while you're sitting at home, it's very easy to go through a hip range of motion stretching program and a shoulder range of motion stretching program to make sure that you're not losing any range of motion gains that you've made over the course of your training. The goal is to have you ready to go when the season starts back up. So if you can make sure you maximize your hip internal rotation and your total arc of motion of your shoulder, meaning your internal plus your external rotation, this can actually put you in a really good place when the season starts back up. The second thing I'll tell you about is your scapula. Now, if any of you have ever had to come see one of the shoulder and elbow or sports doctors for a shoulder or elbow injury, you'll notice that many of us always examine your scapula. And the reason is because the scapula is kind of like the foundation of the shoulder. So if you think of a house, the stronger the foundation is, the stronger the house is going to be. Well, for your shoulder blade or your scapula is the biggest part of keeping your shoulder healthy. When that scapula is sitting in a good position, it actually takes a lot of stress off your shoulder and elbow when you're throwing. When it's sitting in a poor position, meaning it's tipped forward or kicked out to the side, it actually puts a lot of extra stress on your shoulder and your elbow when you're throwing. So while you're home right now, what you want to do is do some scapular stabilization and scapular activation exercises to get those 20 plus muscles that attach to your scapula activated. And what type of exercises are those? Well, it has a lot to do with seated rows, lat pull downs, but a lot of you may not have that right now. So the other thing you can do is use elastic bands. We very commonly recommend band work in our overhead athletes. And so what I would tell you to do is two exercises. One is to bring your arms up like this, pinch your shoulder blades together towards your back as best you can without bringing your elbows past midline, and then drop your shoulder blades down to try to dunk them into your back pocket. You can actually do that without weights or without bands, and you'll feel it in the middle of your shoulder blades. Once you feel really confident in that, then you can add in the resistance band to do that. So these are two easy things, the range of motion and scapular exercises, that can hopefully keep you optimized and ready to go once the season starts. Appreciate you listening to the video. Looking forward to seeing everybody back in the field, hopefully in a few weeks.